All right. Let's bring the meeting to order. So could everyone please rise to salute the flag? So good evening and welcome to the May meeting of the Revere Board of Health. My name is Drew Bunker and I am the Chair of Board of Health. Joining me tonight for tonight's meetings are board members Craig Costanza, and through a Zoom is Neza Luwadi. Attendance also for tonight's meeting are City of Revere staff, Lauren Buck, who's Director of Public Health, Michael Wells, who's Director of Municipal Inspections and Health Agent, and Paula Sepulveda, who's Board of Health Clerk. Tonight's agenda is, first we're going to start to review and approve the minutes from the April 28th meeting. Other Board of Health members, do we approve the minutes from last meeting? Yep. Neza?
Yeah, I approve the meeting.
Okay.
The hours. Sounds
good. All right, and then the next part of the meeting is going to be the Public Health Communicable Monthly Report by Lauren Buck.
Thank you. So I am going to highlight a couple of things on the non-COVID communicable diseases over the last month. Mainly, again, our influenza numbers. We were in the 1-teens last month, and we actually saw a slight increase over this month. We have 130 confirmed cases of influenza. The ages range from, again, a very broad range of ages, 1 month to 88 years old. I think this is indicative, again, of what I said last month, the fact that kind of masks are off a little bit more. The COVID precautions that also help protect against flu are not as strong anymore. And we are seeing throughout the state and the region a delayed flu season. And again, we are no exception to that. We'll obviously continue reporting on our flu numbers. Other than that, nothing significant in our non-COVID communicable monthly report. Other important notes. I want to talk briefly about monkeypox because it is kind of on everyone's mind. So on May 18th, the Massachusetts Department of Public Health reported that a Massachusetts resident tested positive for monkeypox after returning to the U.S. from Canada. Since early May, global public health authorities have been reporting multiple clusters of monkeypox in several countries that do not typically report monkeypox, including Britain, Europe, Australia, and Canada. In most instances, these cases did not have the traditional risk factor, which is recent travel to an endemic country in West or Central Africa. Some recent case clusters have been identified in men who report sex with men. The Massachusetts Department of Public Health is urging healthcare providers to be alert for patients who have rash illnesses consistent with monkeypox. Obviously, I will continue to bring to the Board of Health any updates from the Massachusetts Department of Public Health. And again, this is a notice more for our providers in the area to make sure that they're thinking of this and their potential diagnoses when seeing someone with a rash consistent with monkeypox. And I'll continue to update you all about what we see next. No cases in Revere, obviously, I think that goes without saying, but I'll just say it on record. In terms of COVID, where we are, as of May 23rd, our total confirmed cases are 22,989. We have not seen an increase we have not seen any deaths from COVID over the last month, which is obviously a fantastic number. We're still at 181 confirmed cases of someone with COVID passing away. Our 7-day case average is 29.3. This is a jump from last month as well. Our 14-day positivity rate is now 10.1. As I mentioned last month, this positivity rate reflects only PCR testing, meaning that anyone who's testing positive on an at-home antigen test is not counted in this number. Therefore, I think we can safely assume that 10.1 is an underestimation of our current positivity rate. However, Revere and Massachusetts as a whole is not seeing an increase in deaths. It's not seeing an increase in severe illness or hospitalization because of COVID in any significant way. And this is a good thing. We are going to see waves of COVID. It's not going to go away. We're going to see surges. And I think in general, we can treat this surge differently than any of our past surges because of those other factors. Which brings us to our vaccinated rate. All of our age groups have seen an increase from last month, which is a fantastic thing, some lesser than others. But our 5 to 11s are now 42.6% fully vaccinated. We had we continue to hold weekly vaccine clinics that are open to all age ranges. We had a very successful clinic last Tuesday. So we continue to offer vaccines. Always go to revere.org/vaccine to see the options there. That's the update, and we'll continue to bring you COVID updates until we don't need to do that anymore. Thank you.
Great. So can we move on to the vote on the variance?
Can I do my general update?
Yes, you may.
Okay.
Yes, sorry. General
Okay.
Board of Health update.
Okay, great. So I'm bringing some general information before the board tonight. There's nothing that we are voting on. There's no regulations that you are going to be reviewing. But I want to talk to you about a topic that will be coming before the board in the next couple of months. And the topic is that of biosafety regulations for the city of Revere. The reason this topic is coming before you soon is that we have a development that is happening in the Suffolk Downs overlay district that is specifically targeted to bringing life science research and biotech companies to the city. We currently have an ordinance that talks about the type and risk factor and risk levels of biotech labs that can come to the city. That ordinance is being discussed at the city council currently. When the city council decides whether they want to amend that ordinance or keep it the same, we will then be tasked with writing regulations regarding that ordinance. And I want to talk to you about a couple of different things, but I want to start with the statement from HYM Investment Group, who are the developers of the Suffolk Downs region. And then I'll talk to you a little bit more about the motion that's in the council that will be affecting the Board of Health. And then I'll talk to you very briefly about the current ordinance, then very briefly about different biosafety levels, and then I will also leave you with some materials that you can take home about other towns' regulations that have been written that hopefully will serve as a guide for us when we're drafting our regulations. So I'm going to first talk to you about a statement that HYM has made about what to expect in the Suffolk Downs area of the buildings that are going in. So 100 and 150 Salt Street is the area that we will be talking about. It's being designed to facilitate life science research, manufacturing, office space, parking, and retail space. The stage that they are in development is they have just started foundation work in the main component of the building, and they are anticipating that the building itself will be completed in early 2024. Like most life science development in this region, we are starting design and construction of the building on spec and have not yet identified any future tenants. This is important. I want to make sure that you all are aware. At this time, there are no actual tenants that have been identified who will be coming into the buildings. So we are writing regulations based before tenants have come in, and so we can really design, what we want the regulations to look like, and the tenants who come in will have to abide by those regulations. Any tenant looking to occupy the building will need to submit their plans to the City of Revere for review and approval prior to construction of their tenant space within the building, and can only open and operate under strict compliance with the applicable state and federal regulations, and also the regulations that we promulgate here in the city. The research and manufacturing activities at Suffolk Downs will be substantially the same and regulated the same as those in Cambridge, Boston, Somerville, Watertown, and other cities where substantial life science activity has emerged. I think we're all pretty familiar with the biotech hub that is Cambridge. You are all familiar with a huge biotech firm, Moderna, that has made a lot of news in the last couple of years. They are based out of Cambridge. This is the type of tenant potentially that would be coming into Revere. Most of these locations are in in Cambridge, Boston, Somerville, and Watertown, these buildings operate in areas that are also very potentially urban, highly dense areas, surrounded by residential neighborhoods, apartment complexes. And so that's just something to keep in mind potentially that when we're talking about our regulations. Obviously, all of the future tenants will have to comply by fire protection and life safety standards that are already in the state building codes, fire safety codes that are already in the state, fire safety codes, and also current hazardous material regulations that are part of all of the regulations that are currently out there. And so our regulations would be on top of all of those already existing regulations. Okay. So that's the statement from HYM. So where we are in the process of the committee is that the ordinance is currently still in committee, and the council is working to figure out if they want to amend the ordinance or keep it the same. And so there is a motion that has not, is still in the process that states that that we will create a Revere Biosafety Advisory Committee, which would be under the jurisdiction of the Board of Health, which would include positions like the Director of Public Health, myself, the City Solicitor, the Fire Chief, the Police Chief, the Inspectional Director here to my left, and the Director of Planning and Community Development. And obviously, we would be writing regulations, and then we would be enforcing those regulations, which can look different, but I think we have a good framework because many other cities have already done this. Okay, so our current ordinance would allow for research facilities and labs through Biosafety Level 1 and 3. So that would include Biosafety Level 1, Biosafety Level 2, and Biosafety Level 3. Okay, which brings me to a very, very brief overview about what biosafety levels are. So biohazard safety levels are a classification of safety precautions in the clinical microbiology and laboratory space. And it really is dependent on the specific pathogen that is handled when performing laboratory procedures. They were developed by the CDC. And it is a principle that provides a way for medical laboratory scientists and other lab personnel to identify and limit any biological hazards to reduce risk in a laboratory setting. They also support the principle of biosecurity, which aims at preventing the use of microorganisms as harmful biological agents. As I already mentioned, there are 4 classifications of biosafety level, 1, 2, 3, and 4. The complexity of each level aligns with the infectivity, disease severity, the microorganism's ability for transmission, and the nature of the laboratory work to be performed. I will give a very brief overview of the different biosafety levels. Biohazard level 1, which includes working with viruses and bacteria like E. coli, chickenpox, and many non-infectious bacteria. The level of precaution at this level is minimal and usually involves a laboratory technician wearing something like a face mask and universal standard precautions. Biohazard level 2 involves microorganisms that are responsible for mild infections, things like hepatitis A, B, C, Lyme, Salmonella, measles, mumps, HIV, potentially. Lab personnel are wearing gloves, facial protection, and gown, and obviously all the precautions that are inherent in level 1 are in level 2 plus more. Same goes for 3 and 4. They all build upon each other. Biohazard level 3 includes microorganisms that can be fatal to humans, but for which vaccines and other treatments are available. For example, TB is a very common organism that is studied in biosafety level 3. Other things like malaria, Rocky Mountain spotted fever, yellow fever, and COVID would fall into this potential level. Biosafety level 4 is something that we don't currently have an ordinance for, we don't allow, and there's no, I won't go into the details about what's studied there because we won't be allowing it in Revere already, and the ordinance will not be revised to allow it in Revere. The ordinances are not going to get more broad, potentially they could get less broad. There, in the packet of information, there's a really important article written by Sam Lipson. Sam Lipson is the Director of Environmental Health for Cambridge. He was involved in drafting Cambridge's municipal level regulations way back in the 70s. They've been doing this for a very long time, Cambridge, and that's kind of why it's been a hub of biotech, because they took this on in the 70s. And actually, what is shown is that when municipalities take an active role in regulating, tenants and biotech labs and firms are more likely to come to that municipality because it's a safety guard for them as well. Because they do get, when you get more regulated, there's more protection for them and for residents. So I'll have you look at that on your own time. And then the last thing that you'll see in your packet is just some examples of current regulations that are around. Cambridge is the first one, Peabody, Bedford, and that's it. These are not extensive. These are not the only cities and towns that are regulating biotech. There are many others, but these are just some examples that we found to help educate us when we're making the regulations. Obviously, our city solicitor will be helping us throughout the process when these regulations are coming down, but I just want you all to get familiar with the topic, and we can work on bringing more education to you all. Sam Lipson is someone who we actually have already had conversations with. He is more than willing to come and talk to boards of health and do more education, because eventually the regulations that we are promulgating will require the Board of Health to work with biotech firms in a way where the onus of the regulations will be on the firm itself, but we will have to understand kind of, you know, their safety committees, what they're doing, and all that kind of stuff. So again, this is just a introduction to the topic. I'd say much more to come, and we'll be keeping you updated in terms of what happens at the council level, and when that happens, and then when we can proceed forward with regulations. Any questions? Okay, that's it. Thanks.
All right, now I think the next topic is the vote on the heating variance.
So tonight before us, we have 3 requests for heating variances. A heating variance allows, if approved by the Board of Health, allows a property to switch over from heating to air conditioning prior to the state sanitary code. The state sanitary code requires you to provide heat from September 15th to June 15th. And as we, have milder springs and, it becomes warmer earlier, we have some properties that are requesting a heating variance. If the heating variance is approved tonight by the Board of Health, these properties will be allowed to switch over from their heat to air conditioning effective May 31st to October 1st. The following properties have requested a heating variance. Seaview Towers, located at 510, 515 Revere Beach Boulevard. Friendly Gardens, located at 235 Revere Street. And the Sea-Watch Towers, located at 376 Ocean Ave.
So yes, we're gonna vote on that. So I'm going to, we had talked about this last meeting, but I'm going to approve.
And I'll approve as well.
And I approve as well.
The heating variances have been approved for those 3 properties as listed.
Great, and the last topic for today is the licensing.
Yep, so we actually have quite a few licenses in front of the board tonight. I'll go through each one, and if you want to, I'll go through each one, and at the end, is it okay if you vote on all of them at the same time? I'll just make sure that you all know that all of these licenses we are recommending that you approve. They've all gone through multiple visits from myself and Mike. They've all gone through submitting applications to CitizenServe, which is our online portal for, and they've submitted all the necessary documentation that is required under our current regulations, and they have all passed inspection And so I'll just go through each one individually, and then you can all vote at the end. So our first one is an individual practitioner for Janet Esquerdo, and her inspection was on the 19th, May 19th. She passed, and we recommend that you approve her individual practitioner license. Janet also has applied for an establishment license, and she went under the inspection on the same day, on May 19th. She passed. We also recommend that you approve her establishment license. Just a reminder that under the current regulations, every individual practitioner has to have a license, and then every establishment that houses the individual practitioners also need a license. So Janet is the only microblader who works at her establishment, and so therefore there's only one person who is practicing under her establishment. That is not the case with an establishment called Babe and Beau Spa, which is right here on Broadway. They have two microbladers, Feng Luong, who went under inspection for her individual license on the 9th. She passed as well. We recommend that you approve her individual license. The other microblader who practices at Babe and Beau Salon is Shelley Duinvo. She underwent her individual practitioner inspection on the 9th. She passed, and we recommend that you approve her license as well. And then finally, the establishment, which is actually owned by Feng Luong, they underwent their final inspection on May 23rd. They passed as well. We recommend that you approve the licensing for Babe and Beau, where there are two microbladers practicing. And then finally, we have Katia Ellis Bao. She is applying for an individual practitioner license. She is the sole practitioner at her establishment. Her inspection was the 19th. She passed as well. We recommend that you approve her license. And finally, just her establishment, which is on 91 Hutchinson. She underwent her inspection on May 19th. She passed, and we recommend that you approve her license as well. So a total of, I believe, 7 individual practitioner and establishment licenses for your review today. All of them passed, and we recommend that you approve all of them. Thank you.
Yes, so I'm going to vote first and just approve on all 7.
And I'll approve on all 7 as well.
I also approve all 7.
Okay, great, thank you. We'll pass around the paperwork for you all to sign. And just a quick note about the the body art establishment. Because the process of licensing really got put on hold during COVID, we are playing catch up for most of these licenses. And we are trying to get all of our licensing on a schedule, not just for us, but for the inspectional licensing, so that they will all eventually be on a January schedule to renew, which means you'll probably be seeing all of these licenses come again before you quite quickly, because in January they will all be renewed. And then we will be on an annual schedule, because we are playing major catch up because all of this got put on hold because of COVID. So you will see a couple more licensing coming through in the next couple of months, but then everyone will go through again in January and then be on an annual renewal basis.
Thank you, Lauren.
All right, that's going to be the meeting for today. Thank you.
Motion to adjourn.
Second.